Lumbar lordosis. Can you fix a loss of lumbar lordosis without surgery? In this video, I'm going to review a published study that actually shows where two patients with a loss of lumbar lordosis, also called flat back syndrome, were actually improved and corrected and fixed with corrective chiropractic techniques. So watch right to the end while I review this case study. And the amazing thing is that these techniques are non-operative, non-surgical techniques. Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada, trained and certified in chiropractic biophysics. And what this channel is about is giving you tips and strategies on how to strengthen, stabilize, and even correct spinal distortions and alignments using non-operative, non-surgical corrective techniques, and also showing you ways on how to bend, move, and lift naturally without pain and limitation. So if you want these tips and strategies and you want to learn about corrective techniques, then stay tuned to this channel, subscribe below, tap the notification bell. Like this, you don't miss out on these amazing tips and strategies that I put out on my videos. Now, why is a loss of lumbar lordosis even a problem? Well, let me show you here in the spine model. This is a lumbar spine, so lumbar spine only. 5 vertebrae, 1, 2, 3, 4, 5. In between are the discs. Inside is the cauda equina. So the spinal cord ends at L1, L2, and inside is the cauda equina, come out from these nerves. So the lumbar spine needs to have an elliptical curvature. There's more curve at the bottom, flattens out at the top as it goes into the thoracic spine. And it has a degrees of 40 degrees. We know what the overall global curvature of this spine is based on research models, and it's 40 degrees. When there's a reduction or a loss of lumbar spinal alignment, first of all, it's not as stable and strong in this position. In this position, it's stressing and deteriorating the actual discs. Discs are pain generator. When they're injured, bulged, there's annular tears. It causes inflammation, can cause local pain, excruciating pain, debilitating pain. It actually immobilizes people. I've seen it in my office over and over again, disc injuries and disc bulges. When it irritates nerves, it can trigger sciatica-like symptoms, leg pain into the leg, foot, numbness and tingling, also cause muscle weakness, muscle atrophy, or even a loss of muscle use in the foot, like toe extension or foot drop, okay? So very, very serious condition. Also, you see the joints here, the facet joints, they're surrounded by ligament capsules. They're stretched out. Ligament capsules on the facet joints of the spine are also pain generators, produce a tremendous amount of inflammation when they're injured, also local pain generators. The other thing too is the spine's out of position now. The actual muscle spindles, the receptors that feed information to the brain about the position of the spine and the posture, the Golgi tendon organs, which also feed information to the brain about position and posture, called proprioceptors and mechanical receptors, they're now distorted. So now the body and the spine has to compensate because of this distortion, causes postural distortions, more problems. Very, very bad situation, okay? I also want to show you on this nerve chart right here, I'm going to walk over to it in a moment, on the actual nerves where they extend not just into the legs but also into the organ systems in the lower pelvic region, why that can be a problem too when those nerves are irritated by a loss of lumbar lordosis and associated problems like disc injuries and disc bulges. And then later on, I'll talk to you about some of the techniques that we use to correct this, the non-surgical techniques that we use, and as well I'll review this published case study where it shows two patients where they were applied these corrective techniques. These are by other doctors, and we apply the exact same corrective techniques in our office called corrective chiropractic care or chiropractic biophysics. And I'll show you and review this case study with you, show you some before and after lumbar spine pictures, and you can see the actual corrections that were done on the loss of lumbar lordosis without surgery. First of all, let's take a look at this chart. So let me show you this nerve chart right over here. I had this in my adjusting area right now. That's where I'm filming, in my adjusting area. And you'll see the lower lumbar spine is actually elliptical in shape, okay, which matches the model that I showed you right here, okay? So nice elliptical shape. And inside here are the spinal nerves that emerge from the actual openings here of the spine. They go into the lower pelvic organs. So they go into the large intestine, they go into the bladder region, the kidneys, and also the sex organs, men and women, okay, sex organs, okay? So when there's a loss of lumbar lordosis, not only does it affect local back pain, local disc injuries, nerves that shoot down to the legs, like sciatica-like pain, but it also can affect any one of these organ systems in the lower pelvic region, colon, bladder, sex glands. So that can be very, very important to know that. If there's associated symptoms that should be brought to the attention of your doctor. So that's why we assess the spine to not just see what's happening with the actual low back and leg pain, but if there's any other problems going on with the person's health. Okay, so that's why it's also important that this loss of lumbar lordosis needs to be corrected. So two of the biggest problems that I see patients run into when they have a loss of lumbar lordosis is, number one, they may just have an MRI study only. And an MRI study only is not enough to begin the process of analyzing the spine for structural alignment, because you need a full spine assessment, not just the MRI of the lower back or the lumbar spine. As well, an MRI is done in a lying down position, so you're not standing up against gravity, so you're not getting an accurate assessment of what the spine is doing when it's lying down, and it's not the gold standard for assessing spinal alignment. Yes, it is the gold standard for assessing soft tissue injuries on the spine, disc bulges, disc herniations, disc injuries, nerve compressions, but not for spinal alignment. The other mistake is that a patient will come in and say, well, I have x-rays already that you can use for the spinal alignment. Two problems that we may run into. One, were those x-rays done lying down recumbent? Again, you're not going to get an assessment of the spine against gravity. And number two, was the rest of the spine also x-rayed, which is the thoracic spine and cervical spine, so mid-back, low back. You need a full spine assessment to see what the correlation of the pelvis is doing to the sacrum, and the sacrum to the lumbar spine to the thoracic, and then the thoracic spine to the cervical spine. And without that, just looking at the low back on its own will not give the actual best analysis of what to do with corrective non-surgical techniques. Now, having said that, when you get a full spine assessment of the spine, neck, mid-back, low back, cervical, thoracic, lumbar spine, front and side. Now, what we do is we apply corrective methods and corrective techniques. The technique that we use is called chiropractic biophysics, which has over 300 research publications and scientific publications and clinical. Some of them are clinical trials. Some of them are brand new research on mathematical models of the spine, and some of them are case studies. Today, I'm going to show you one of the case studies and review that with you in a moment. And I'm trained and certified in chiropractic biophysics, and I've attended many courses, and I've learned these chiropractic techniques that we've applied in our office with our patients through chiropractic biophysics techniques. So what this technique does is it gives us an actual full spine assessment and correction protocol, and it focuses on correcting the actual structure of the spine before we actually tackle the function of the spine, or functional rehabilitations type of things, which are movement, strength, and so forth. So we need to assess the structure of the spine. And you can imagine that a loss of lumbar lordosis is a structural problem. So we need to see what this is, what's happening. And now that we can assess it with our techniques and the strategies, then now we can apply techniques to actually improve it into a better position. So after I review this case study with you, I'm gonna show you and point you to a video where you can actually get basically, it's a 2-minute video. You can see about all the techniques that we use to actually correct the actual loss of lumbar lordosis, fix the loss of lumbar lordosis in our office, the actual exercise that I give, the home exercise traction that I give, and also the in-office traction protocols that we do to help improve that lumbar lordosis. But let's review this case study first. Here's the case study I want to present to you. It's from the Journal of Physical Therapy Science. Here is the reference right there, okay, 2018. The authors of the case study are Dr. Deed Harrison and Dr. Paul Oakley, chiropractors. Dr. Deed Harrison is the lead instructor of chiropractic biophysics seminars and training, and Dr. Paul Oakley is a chiropractor in Ontario. He's actually a colleague of mine, a friend of mine, practices close to me in Newmarket, Ontario, and Dr. Deed Harrison is out of the United States in Eagle, Idaho. And the title is a non-operative correction of flat back syndrome using lumbar extension traction, a CBP case study of 2. And loss of lumbar lordosis is also called flat back syndrome in the literature. Okay, and it's a free article. You can search it yourself on PubMed. Here's a free PDF. You click on the PDF over here at the top right link, and it'll open up this nice PDF for you if you want to read it in a nice clean PDF form. Okay, I'm going to use this site here because I like the way it's laid out for the video purpose. Okay, so you can read the abstract and the introduction. I like the introduction. It talks about 7 different possible causes of flat back syndrome or loss of lumbar lordosis. And I'm not going to go through all those. You can look at that yourself. Okay, and in the case study, they had 2 patients. Okay, 2 patients. So it talked about the actual participants and the methods.
the patients, and what they did was they examined them, they took x-rays of the spine, and they measured the x-rays and compared it to what it should be, okay? So here's what they did with the patients, okay? This is very important. Take a history and an examination, okay? These are all the different measurements of the spine. I'm not going to go through all that. It's a lot of detail there. You can look at that yourself. I want to go over the big picture, okay? The methods they used to measure the loss of lordosis was the Harrison posterior tangent method, okay, which has been tested for high reliability, okay, and they also looked at the individual measurements of the spinal alignments between each segment, okay. The technique they used, they were both treated with short-term lumbar spine manipulation for pain relief, and then long-term treatment with extension traction based on 3-point bending, okay? And what that looks like is this, okay? So here's 3-point bending lumbar extension traction. Why is it called 3-point bending? Is because the thighs are strapped down below the pelvis to get that pelvic tilt, that anterior pelvic tilt that I keep talking about, that you want in lumbar lordosis. And then the shoulders are pinned down also over here, contacted with the table. And that's 2 points of bending, so 1 and 2. And then the actual strap is behind the lumbar spine, pulled from back, so posterior to anterior, so from the bottom of the table to the ceiling, and it gets the lumbar spine pulled into a lordosis, okay? So that's the method for long-term treatment after the short-term chiropractic manipulation, okay? So case one, 27-year-old male, complaining of low back pain, symptoms were constant, moderate, disabling, rated the pain 8 out of 10, and there's radiation of pain to posterior thighs to the knee, and this patient tried other methods of treatment, including physical therapy and chiropractic, had no success. The patient's pain was so great that he noticed marked disability in his activities of daily living. Previously had been recommended for surgery, as he thought that all of his options have been exhausted, okay? They did a physical examination, okay? And then they looked at the X-ray examination, okay, of the spine. So the L1 to L5 absolute rotation angle was plus 14 degrees. So it should be normally negative 40 degrees. So negative means it's a lordosis. Positive means it's around to kyphosis range, which means it's reversed in the opposite direction, which is not good. Sacral base angle is negative 8 degrees, should normally be in the positive 40 range. So positive 40, so 39.4. The sagittal translation, which basically is where is the spine at T12 in relation to the sacrum in the vertical position, and it was 54 millimeters at the beginning. It should be 0, lined up. Okay, and they did other measurements as well in the table above, which I showed you, but I'm not going to go into those details. So these are the results. So here's picture 1, I can't click it, but A over here to the left, that was the initial examination X-ray, and then over here, B, C, and D is the post X-ray. So under figure 1, you'll see over here, patient A, the vertical black line represents the ideal sagittal alignment of the posterior inferior body of T12 relative to the origin of the posterior inferior body of S1. All that means is so this vertical black line over here that goes up and down, where is T12 in relation to S1? And it's very forward, which I showed you earlier. The black ellipse represents the ideal curvature of the posterior vertebral body margins of L1 to L5. So that's where the spine should be normally aligned. So this elliptical smooth line over here is the ideal line of the spine, and then the black line at the posterior margins of L1 to L5 represents the patient's lumbar curvature. So these dashed lines over here along these white blocks, that's where the patient is. So they're comparing the patient alignment to the normal elliptical curve. And A, at initial lumbar alignment is A. So you see that there's a loss of lumbar lordosis with a mid-kyphosis. And then B, 10 weeks post-treatment after 50 treatment sessions. Okay, so that included the initial pain relief, spinal manipulation sessions, plus the corrective care, 3-point bending, traction, lumbar extension sessions. Okay, and you can see that the lumbar spine is beginning to improve. Right, and then at C, so C is at now 100 post. So this is a post-treatment lumbar alignment after 100 treatments. You can see that these things don't correct very quickly. They take time, they take effort, they take energy and commitment. So this is done over 100 treatments. So this is possibly 2 courses of treatment that were done for this patient. And then D, so you see now it's beginning to improve here at C, okay? And D, you see the lumbar spine is actually improved significantly. So So 30-week follow-up. This is 30.5-week follow-up. The lumbar spine not only improved, but also maintained its improvement and continued to improve even more. So that's pretty cool, okay? Now, case two. So case two, 31-year-old male with chronic low back pain reported sharp pain, severe pain, scored an 8 out of 10, 8.5 out of 10 with radiation to the right gluteal area, increased frequency, duration, and intensity over the past 3 years. 2 months prior to treatment, the patient was placed on temporary disability, was taking Valium, Norpirmin, diazepam for treatment of this pain. Those are medications. Okay? Physical examination had decreases in all thoracic lumbar range of motion. The muscle strength evaluation, lower extremity showed weakness at L1 to L4 dermatomes, and then had positive minor sign, which means had trouble getting up from the seated position, which is a classic sign for low back pain. And the lateral lumbar x-rays revealed negative 12, which is a loss of lumbar lordosis with a mid lumbar kyphosis as well. Sacral base angle 18, which is reduced, and the sagittal translation distance T12 to X1 is 72, which should be 0. Okay, so A. Here's A, beginning. So loss of lumbar lordosis away from the sagittal vertical alignment line, and you see a kyphosis as well in the mid to lower part of lumbar spine. And then B, so at the bottom, okay, so B, this is 8.5 weeks post-treatment after 35 sessions. You see that there's beginning to be an improvement in the lumbar lordosis. And then C, this is pretty cool, 16.5 weeks post-treatment of lumbar lordosis, and after a total of 70 treatments, there's a continued improvement and of the lumbar lordosis. Okay, so that's pretty cool. Okay, pretty clear. So what they looked at and they said was that the treatment given for both cases was chiropractic physics, posture, and spine rehabilitation procedures, and which is a full spine corrective approach to realign posture and spine towards normal ideal configuration, which is what I mentioned earlier. Okay, and then if I look at the results, so case one was given 50 treatments over a 10-week period. First post-treatment assessment, the patient claimed to have increased ability to take part in activities of daily living, reported marked improvements in its pain, so it went from 8 out of 10 to 3, had increase in lumbar lordosis to negative 10, okay, versus positive 14. So that's a massive increase in lordosis, and the sacral base angle improved to 26 degrees from 8 degrees, and there's a reduction in the anterior sagittal balance of 54 millimeters from 45 millimeters from 54 millimeters. Okay, and then when the patient was treated further another 50 times over the next 10 weeks, it showed continued improvement of pain. So pain was reduced now to 1 instead of 8, and a continued improvement in lumbar lordosis to 24, okay, from 10 degrees, okay, versus initial 14 degrees, and then the sacral base angle was actually preserved, and a further reduction in the actual sagittal balance of the spine. So the patient returned for a follow-up 38.5 weeks later after the termination of the initial 20 weeks worth of treatment, and this pain score was still reduced and showed a continued increase in lumbar lordosis, and also further increase in sacral base angle and a maintenance of sagittal balance. So basically showing that there is stability improvement throughout this entire case, and they said here all radiographic parameters demonstrate stability improvement without further treatment and follow-up, which is pretty amazing. Okay, case two. So case two, patient, 35 treatments over 5.5 weeks. The first post-treatment examination showed an increase in lumbar range of motion and normalization of lower extremity strength. So the person's strength improved, pain reduction from 8 out of 10 to 3 out of 10, and increased lumbar lordosis to 26.5 degrees from 12 degrees. So that's cool. And then the improvement in sagittal and sacral base angle from 18 degrees to 28 degrees, and there's a reduction in the anterior sagittal balance to it went from 72 millimeters to 54 millimeters. Okay? When the patient was placed on a second treatment program for the next 35 treatments over an additional 8 weeks, it led to continued improvement. So it was decrease in pain 1 out of 10 from 8.5, continued increase in lumbar lordosis, and the sagittal balance improved as well, and the sacral base angle also improved. Okay, so basically they showed that the use of lumbar extension traction in loss of lumbar lordosis and flat back syndrome improves not just the alignment of the patient's spine, but also their sagittal postural balance and also decrease their pain and decrease their disability and help them improve back to a normal functioning life. Okay, so that's a pretty cool case study to show. And these are the kind of techniques that we apply in our office as well.
Was that an interesting case study by Dr. Deet Harrison and Dr. Paul Oakley? I find that fascinating. Those two patients that had a flat back syndrome, loss of lumbar lordosis, and you can see in the photos the corrective techniques they applied, and also the before and after pictures where they improved the lumbar lordosis. That's the kind of stuff that we do in our office. It's called chiropractic biophysics, corrective care, which essentially is non-surgical corrective methods to improve spinal degenerative problems, spinal alignment problems. Now, I want you to watch this video right over here, right there, right now, to actually visualize some of the actual techniques we apply in our office, how we use a Denneral table for lumbar spine traction, the universal traction table, and also the exercise we offer to our patients in office and at home. Check it out right over here, right now.